and welcome back. As the world's first HIV and AIDS service organization, GMHC is actually working to end the AIDS epidemic and uplift the lives of all affected. Now, they serve over 10,000 people each year living with and affected with HIV and AIDS in the 5 boroughs of New York City, and they believe the community can end the epidemic by addressing the underlying causes, shifting cultural beliefs, and promoting smart behaviors, empowering a healthy life for all of us. Joining us now and sharing more, we're pleased to have Director of Community Relations at GMHC, Krishna Stone. And Krishna, glad to have you. And for your organization, I know that it's got to be a little challenging, particularly with the COVID-19. Those who are definitely affected a lot in the HIV and AIDS community, who've definitely needed services and have been heavily impacted as well.
Yes, GMHC during the COVID-19 pandemic had to pivot providing services remotely. So most of the services continue to be provided remotely. However, we are now open Monday through Friday for people to access services by appointment only. What happened for us is that it was not an option for us to close. So we knew we needed to continue providing care services to people living with and affected by HIV and AIDS, our HIV prevention and testing programs, and our public policy advocacy at all levels of government. So some of our services that we have here include mental health and substance use counseling, grocery bag distribution, because prior to COVID-19, we did have congregate meals where our clients would come to the building to have lunch, and Monday through Thursday, we served 300 to 400 lunches, and then on Friday, we would serve 300 to 400 dinners. So what happened was in 2020, we shifted to packing and distributing bags of groceries to our clients in most need. And each Wednesday, for example, we distribute bags of groceries, which include shelf-stable food, ready-to-eat food, fresh produce, and dairy products. And while we surely miss our clients in terms of being able to interact with them in the building, it is lovely to see our clients when they do come to the building now each week. So we also have legal services. We have connections to housing. We have 2 housing programs. Gosh, we do so much.
Yeah.
And through our fundraising efforts, which consist of fundraisers. So we have our largest fundraiser coming up on AIDS Walk New York. It's back and it's live on Sunday, May 15th. And we also reach out to with proposals for grants, government grants, foundation grants, and we have individual supporters. So to say that we provide an array of services, that's just the beginning. So when a person comes to the agency to become a client, we go through a fairly intensive intake process. That's another word for an interview, so that we can best understand what's going on in the lives of our clients. And many times people come, when they also become a client, we recognize the health disparities that they may be facing, which include experiences with homophobia, transphobia, racism, stigma, discrimination, poverty, lack of quality health care, jobs and housing, and violence, police brutality, and more. And these health disparities create barriers for people living with and affected by HIV and AIDS to access care and HIV testing and prevention. So through our work, individually and as an organization, we work to address these health disparities so that people can continue to be healthy, and that their well-being is healthy, and that they're able to move from survival to thriving and to feel like they can move forward in ways to access housing, access jobs. And we know that stable housing, stable work, enough food in your home really helps people to stay healthy, and they also continue to be consistent in taking their medications, which reduces their viral load to undetectable. And that's also, not only is that good for the individual, it's good for the community, so
Yeah.
that people are living with an undetectable virus to their sexual partners as well. So it
Right.
works on a prevention model too.
Let me jump in and ask this question about when your organization first got started, and you dealt a lot, particularly at the height of the HIV and AIDS epidemic. You had a lot going on in terms of questions about homophobia and that HIV and AIDS being related as a gay disease, and we knew that that wasn't true. But yet, and still, that homophobia, though, that the stereotypes, they were out there. They still exist. Looking at where we are today, talk to us about how is it in terms of homophobia? Have we gotten a whole lot better? And what about messaging? Because I think that part of those disparities, you can break those disparities down with proper messaging.
Yes, so how we break down the impact of health disparities, there's multiple ways. It's a multi-layered activity. So we do create messaging through social media networks, through interviews such as this one. So interacting with the media outlets is very, very helpful so that people are hearing and receiving accurate information. We also address health disparities by being a part of coalitions and with other leadership in HIV and AIDS service organizations, community-based organizations, our elected officials, faith communities. We work with a variety of organizations to band together so that we're all collectively moving forward in addressing health disparities and providing accurate and supportive messaging. Stigma is still a huge problem and has been for 41 years during the HIV and AIDS epidemic. This year, GMHC commemorates 40 years as well. So, and it also, to address health disparities, we have to be creative, because it's not a linear process. You just don't go into a community and go, stop it. It's just, that's not going to work. So we work within the communities. We have folks coming to the building when we can do that more, and a variety of ways to communicate really helps. And also having these relationships with different entities and partnerships are essential in our work because we cannot do this work alone. So it really involves a team effort, not only within GMHC, but externally.
Yeah, you got a 40-year anniversary coming up. And so talk to us about this 40-year anniversary. What does it mean for your organization being around on the front lines for so long?
This year, being the 40th year for the organization, allows us to reflect on where we've been, how we started, formerly as Gay Men's Health Crisis. We still say Gay Men's Health Crisis, but we also say GMHC. We also reflect on what we are doing now in terms of balancing our work within an epidemic and the pandemic, and also where do we need to go? Not just towards the end of the year, but the next 5 years, and what kind of strategic planning do we need to continue to do? So I think of it as also a time to, look at those milestone moments that have occurred throughout the years. And, for example, in 2019, we brought back the AIDS Dance-a-thon, which was one of my favorite fundraisers, 5 hours of dancing with thousands of people. And that started in the early 90s. And in 2019, we were able to bring it back, and that was just tremendous. So we can look at and evaluate, can we do this event again? Or do we need to do this event and create another event as fundraisers? What about our programs? How effective are they? Do we need to expand or merge programs? So this is a really important time to evaluate, think, make decisions on where we're going today and also where we're going tomorrow.
When you look at tomorrow, what do you see in the future for your organization?
I think the future, just staying the course to help to end the HIV epidemic. And that means continuing our partnerships and expanding our partnerships, finding new partners, supporting the partnerships that we've had for years. It means continuing to fundraise because fundraising has ebbs and flows, of like in terms of funding that dries up and then opportunities for new funding. And how does our development department keep track of what's going on with funding sources? And also maintaining our relationships, particularly with our elected officials, city, state, and federal, and continuing to raise awareness with our elected officials about the needs of people living with and affected by HIV and AIDS, and also advocating for funding from government entities to stay and or expand as it relates to the needs of people living with HIV and AIDS. So, and also another reality is we don't have a cure. We don't have a vaccine. We don't have a pill that makes all of this go away. And so we need to continue to advocate to the world of researchers that they must, hold HIV in the forefront of their work as well. And also the researchers who are looking at increasing prevention methods. For example, a new prevention method that has occurred is an injectable PrEP, called Epidemic, and PrEP is pre-exposure prophylaxis. And for those who are not aware of PrEP is started in, it came into the universe in 2011, and then the medication started in, then moved from 2011 to 2012. This is when a person who is HIV negative takes a pill that is an HIV medication once a day, and it is 99% effective in preventing HIV, if they're exposed to HIV, from setting up in their body. So, and now, so the PrEP has been really helpful in preventing new HIV infections. And now with Epidemic, people can go and get an injection of an HIV medication, and that lasts for a few months. And that might be easier for people to not have to take a pill each day. So the more advances we have with medication, both for people living with HIV or people who may be at risk at HIV, that is very beneficial as well. So it's all of these elements moving forward that have to stay in, stay with the progress that we have made and will continue to make. What I would like to see, and I've been at GMHC, this is my 29th year as an employee, I would like for us to continue to do more work with helping people to talk about all the kinds of sex that we have. People still find it very difficult to talk about sex. And that's understandable with the cultural and religious barriers and other community barriers. However, having these difficult but yet brave dialogues allows for people to check in with support about their sexual health and how that connects to their overall well-being. So the prevention work that we're doing, that has to continue moving forward, and the messaging around prevention and also access to care for those who are living with HIV and AIDS.
Yeah. Well, Krishna, we're going to leave it there, but thank you so much for joining us, sharing about the GMHC, 40 years of great service to the community, and we know that we've got some great things to look forward to. Thank you so much for being with us.
Thank you, and the work has to continue. And for those who are interested, gmhc.org is our website, and check it out. We have all kinds of really important information.